Welcome everyone. Welcome to webinar 1 of a 4-webinar series. We acknowledge the traditional custodians of the land on which we meet. For me, this is Darug people. We pay our respects to elders past and present and acknowledge the Aboriginal people for the custodianship of the land. Okay. So my name's Katrina Shade, and today's webinar is specifically addressing pregnancy and mental wellbeing. So I'm the team leader for the Western Sydney Local Health District Perinatal Infant Mental Health Service. We have a wonderful expert panel with us in our virtual background. Dr. Lara Hawari is a perinatal and child and adolescent psychiatrist. Chris Barnes, slide. There we go. Chris Barnes is a perinatal psychologist and clinical team leader for Gidget Foundation Australia. And Anna Maria Monos is a clinical midwifery consultant at Blacktown Hospital. We'll go this way. There we go. All right, so a few key points to start with. This webinar is being recorded. The information presented today is designed for general public education and is generalized. We acknowledge that everyone's experiences and circumstances are unique. Mental health is not black and white. Please think about this information for yourself and in relation to your friends and family that may be pregnant or supporting someone that is pregnant. With this webinar series, we hope to reduce stigma of mental health challenges, encourage people to talk about it, and encourage others to feel okay to speak up. We want to reduce shame associated with mental health challenges, disorders, or illnesses. Please feel welcome to take photos of slides. In fact, we encourage you to. We have enabled the chat function in this Zoom session for you to ask questions to the panel. Only the panel will see your questions or comments and will address the main themes towards the end of this hour. If we have any healthcare workers attending, please feel welcome to post comments about your experience and we will try to share. If any of this presentation has raised some concerns for you, we encourage you to seek support. There will be slides throughout and at the end of the presentation. So in this webinar, we'll be covering some normal experiences and expectations of pregnancy, describing stress and worry during pregnancy and what anxiety and depression in the antenatal period may look like, and briefly covering other mental health challenges or illnesses. Our presentation will include information on COVID-19, the vaccine, and the impact of COVID-19 on the antenatal experience. We will then provide some information of treatment and management options to help with mental wellbeing and mental illness, including resources and different modes of support. There's a lot to cover in this presentation. If we've missed anything that you feel is important, please share in the comments for the panel to cover at the end. So I'd like to hand over to Chris Barnes to introduce our partners in this webinar series, Gidget Foundation Australia.
Hi everyone. Thanks Katrina, and lovely to have you all. Although I can't see you all, I know that you're there and listening to this webinar. So I'm the clinical team leader at Gidget Foundation Australia, and part of our mission is to help the emotional wellbeing of new and expectant parents of all different cultures, backgrounds, non-biological parents as well. So we deliver counselling services, and I'll tell you a little bit more about those towards the end. But look, just to sort of establish why Gidget Foundation Australia has the name Gidget, a beautiful Sydney woman, Louise, and you can see her photo here, took her own life while she had sort of unrecognised postnatal depression 20 years ago now. And she masked it from all of her loving family and friends, and they all got together and did some fundraising and hence established Gidget Foundation, and it just kept growing to what it is today. So I guess another sort of mission of ours is to make sure that that doesn't happen to others, hence our commitment and dedication to helping new and expectant parents. Thank you.
Find my unmute. Thanks, Chris. And I might just turn my camera on from here, and here we go. Yeah, thanks, Chris. So the following is an excerpt from a poem that recognises maternal welfare and the bearers of our generation. The hand that rocks the cradle is the hand that rules the world. Blessings on the hand of women. Angels guard its strength and grace. In the palace, cottage, hovel, oh, no matter where the place. Would that never storms assailed it, rainbows ever gently curled, for the hand that rocks the cradle is the hand that rules the world. This is an excerpt from a poem by William Ross Wallace. Noting the age of the poem, I think we can add partners and all caregivers into this notion that no matter where we are from, the people raising our children and nurturing our next generation. Pregnancy, normal experiences and what to expect. There are many changes to lifestyle and well-being that will affect us all to some degree. It is normal to experience mixed feelings during pregnancy: joy, worry, anticipation. There will be physical changes such as body shape, aches, discomfort, and changes to sleep positions. Psychological changes may include identity changes, career considerations, reflecting on own childhood, ambivalence towards pregnancy, additional worries or stresses, such as COVID-19, and bonding with your unborn baby. Previous pregnancy loss or other grief experiences may surface to your conscious mind. Individual personalities will influence how experiences are perceived and processed. There may be social life changes. There we go, including relationship changes with your partner, friends, family, and others. There are more pressures about do's and don'ts of diet, and your exercise regime may require some changes. Spiritually and philosophically, pregnancy is a time of reflection on our beliefs, our values, and what parenting might look like for you. Financial situations related to income and cost of living require consideration for planning ahead for a life with a new baby. The role of a partner has changed over the years. Partners are now more involved in medical appointments, the birth and postnatal period. There are psychological and practical considerations to changes in work, finances, home, and managing their own relationship needs with the new addition in the family. Morning sickness can be more than just a bit of morning nausea and can occur at any time of the day, and when severe, may require medical treatment. It can also be quite debilitating on one's mental health. Having a baby is an emotional experience, and it's normal to experience some stress and worry during a pregnancy. Stress happens in your body, worry happens in your mind. Your experience counts. This could be difficulties conceiving, an unplanned pregnancy, pregnancy lost, recent stresses, a history of trauma, financial concerns, emotional changes, body changes, physical health issues, such as excessive nausea and vomiting. Extra worries, such as the risk of contracting COVID-19 and what this might mean for you, your unborn baby, and your family. This might look like heightened alertness or overthinking a trip to the supermarket. What would have been a reasonably stress-free task, unless you have a toddler. There is extra worry about getting the COVID-19 vaccination during pregnancy, attending antenatal appointments at a hospital, what your birth experience might be like with hospital visitor restrictions, and how you may cope taking baby home without the extended family support you were hoping for. The lockdown is a rather stressful life. There is also the worry related to the well-being of your family and friends all around the world in this pandemic. Some stress and worry are important as they act as motivation to get things done, such as being late in your pregnancy and not yet having bought a cot. Stress like this acts as a prompt to buy the cot, even if the only option is to buy online. Too much worry or stress can become overwhelming and make it difficult to cope. It can affect your body, thoughts, feelings, or behavior. A common example is where worry is represented by racing thoughts, causing disruption to sleep. Stress in expectant fathers is more likely where pregnancy is unplanned. Men had heard negative accounts of fatherhood from other men, and they were unclear about what to expect at the birth. Acknowledge the increased level of stress or worry for you, and notice if this has or is developing into an anxiety that is impacting on your daily functioning. Eat the right foods, maintaining exercise, getting enough sleep, talking to someone, or trying a self-help strategy can help. Anxiety. Anxiety happens in your emotions, body, and mind, such as a sense of impending doom, panic or danger, hot or cold flushes, sweating, tightening of the chest, quick breathing, racing heart, feeling restless, angry behavior, avoidance of situation, nausea, feeling tired or weak, difficulty sleeping, lots of racing thoughts in your mind, past or future thinking, difficulty relaxing, difficulty concentrating, obsessive thinking, catastrophizing thoughts. Catastrophizing thoughts stop our thoughts from being in the present. We think about an unknowable future. These thoughts tend to start with the terms what if or I might, such as what if I'm in a car crash on the way to hospital, or what if I give birth in the hospital elevator. The nature of these thoughts are quite over the top. Excessive fear or worry, such as dominating thoughts of how am I ever going to cope with a baby. An increase in worry chemicals rushing through the body triggers heightened arousal of sight and hearing, leading to overstimulation and difficulty concentrating. All these things happening together can lead to exhaustion, loss of concentration, and agitation. Normal or appropriate anxiety helps us deal with danger. It is important to note that anxiety can manifest differently in different cultures. Some cultures express anxieties with more physical symptoms. So there's different types of anxiety, such as generalized anxiety, which can look like what if thoughts. For example, what if my baby's not healthy? Or what if I don't feel my baby moving enough? Something must be wrong. Panic, which is an intense and overwhelming fear and loss of control, usually with no identifiable trigger. Adrenaline makes the mind race, the heart rate increase, and you may feel your heart thump harder. Your breathing may become more rapid. The sense of impending doom adds to the cycle of anxious thoughts. There are specific phobias, for example, tocophobia, which is the fear of childbirth, and trypanophobia, the fear of needles. And another phobia to be mindful of related to the antenatal period is white coat phobia or iatrophobia, which is the fear of doctors or attending medical appointments. And agoraphobia is the fear of being out in open spaces or within crowds where help may not be accessible. For example, a fear of being in a shopping centre in case something goes wrong with the pregnancy in the middle of the shops. Social anxiety is a fear of meeting new people or so having family visit. It's usually related to a fear of social judgment. Intrusive thoughts. Research indicates that up to 80% of pregnant or new parents experience intrusive thoughts occasionally. These thoughts may be images, thoughts, or impulses that are unwanted, negative, and worrying. They can be fleeting or more persistent, mild or intolerable. The thoughts may be related to harm or witnessing harm to their baby or others. Obsessive-Compulsive Disorder, or OCD, is characterized by the presence of obsessions, compulsions, or both. Obsessions are recurrent or persistent thoughts or urges that cause marked anxiety or distress. The person suffering might try to reduce the distress by some other form of thought or action. The compulsion are the repetitive behaviours or mental acts that the individual might feel compelled to perform in response to the obsession. And these are aimed at reducing anxiety and neutralising the effect of the obsession. An example would be an obsession about germs affecting the baby through infection. These thoughts are so distressing that the mother may find herself repeating rituals of hand washing and showering several times a day in order to ease the distress from these thoughts. The thoughts often have a catastrophic nature to them. If we think about these types of anxiety, for some people, it might look like significant difficulty attending the hospital for their antenatal care, or they may contact medical professionals frequently for reassurance. If any of these types of anxieties or phobias, or perhaps a different one not mentioned, are concerning you or your antenatal experience, please speak to your midwife or obstetrician regarding how they can support you. It's important to consider anxiety on a spectrum, where at one end it is helpful and an important motivator. Anxiety can become a barrier to being present in the moment and enjoying life, and then pass. Or anxiety can impair one's ability to function in daily life and be classified as an illness or a disorder. An anxiety disorder or illness is where your worries are persistent and out of proportion to the situation. Approximately 10% of women experience problematic levels of anxiety during their pregnancy. So signs of when to be concerned about anxiety. If it's constant or ongoing, irrational or excessive, no obvious or logical reason for feeling anxious, impacting on your ability to attend daily activities, impacting on relationships. Your partner or friends may not understand your anxiety, which can lead to miscommunication and relationship rupture. May interrupt your ability to enjoy your pregnancy. For some, excessive anxiety may interfere with prenatal bonding or ability to keep your baby in mind. So moving on to depression. Depression is not just a bad mood, it is an illness. Depression can also be considered on a spectrum from mild, where a person might be quite functional, through to severe, where daily struggles with a low mood have a significant impact on life. As with anxiety, culture can affect how the depression is expressed. In many cultures, emotional well-being is not talked about or acknowledged. For some, it's expressed in their body, such as aches, pains, headaches, or weakness. 1 in 10 women will experience antenatal depression. So some symptoms of depression include feeling sad, a low mood, crying for unknown reasons, feeling constantly tired, sleeping a lot or difficulty sleeping, social withdrawal, easily annoyed, difficulty with memory, focus or concentration, reduced interest in activities normally enjoyed, losing interest in sexual relations, thoughts of self-harm, death or suicide. We all have bad days. We need to validate this as being normal. However, seeking support is encouraged if the symptoms last for more than 2 weeks, there are more bad days than good, your partner, family, friend or colleague says they're worried about your well-being, you are feeling a lack of connection to your unborn baby, your mood is impacting on work, study or ability to attend to routine activities, or impacting on relationships with friends, family or colleagues. If you have thoughts of harm to yourself or others, other symptoms of depression aside, reaching out immediately is important. Some other mental health challenges we will mention include the baby blues, which is a common emotional state that occurs in up to 80% of women within the first few days to 2 weeks after a baby is born. Postnatal blues can be mistaken for depression. However, the baby blues do not usually last longer than 2 weeks post-delivery. Some symptoms include tearfulness, moodiness, or feeling overwhelmed. If you are unsure, if you are experiencing the baby blues or depression, please speak up and ask a health professional. Self-esteem is a term used to describe the way that we think about ourselves. A healthy self-esteem enables us to hold realistic expectations of ourselves, to be assertive, and to accept feedback from others. When our esteem is low, we tend to criticize ourselves, ignore our strengths, feel self-conscious, and try overly hard to please others. How you treat yourself will impact on your mental well-being. A positive self-esteem can be nurtured and grown. Be aware of and challenge your inner critic. Notice when you're avoiding something and reduce this behavior. Set realistic expectations. Identify your positive qualities. Notice when others treat you poorly. Practice self-compassion. Postpartum psychosis. So we have mentioned postpartum psychosis here, which is the onset of a psychotic episode following a birth. But we've mentioned it here because it's an important condition to be aware of, especially for family and friends to know the signs to look for and to speak to a medical expert immediately if there are concerns. Postpartum psychosis is a severe but treatable mental illness that can occur in the period after childbirth. The prevalence of this condition is about 1 to 2 in 1,000 women and usually occurs within the first 4 months after giving birth. There are some women who are at a higher risk of postpartum psychosis. For example, women who have a history themselves or a family history of bipolar illness. Postpartum psychosis is a medical emergency and urgent treatment should be sought. So signs to look for include being overly excited or elated, having too much energy, not being able to sleep, racing thoughts, being very agitated, strange or irrational beliefs that could not be true, feeling paranoid, aggression, extreme sudden mood swings, disordered speech, or responding in unusual ways towards the baby. So trauma, the meaning of trauma is a deeply distressing or disturbing perception of an experience. Your experience of trauma may be triggered during this life-changing period of becoming a parent and impact on your ability to develop a connection with your baby. A history of trauma increases the risk of perinatal, so that's antenatal and postnatal depression. So post-traumatic stress disorder is related to a single traumatic event that could have been life-threatening, such as a car accident, serious car accident. Complex PTSD, complex post-traumatic stress disorder, results from persistent or prolonged traumatic experience, such as domestic abuse. An acute stress reaction is a self-limiting stress directly after a traumatic experience and is short-lived and resolves within 3 months. Adjustment disorder is distress experienced directly as a result of sudden change. This can present in a variety of ways, including depressive symptoms, anxiety, changes in behaviour, and will usually resolve within 3 to 6 months. This slide is sharing a little about underlying processes of trauma. In different states of relaxation or distress, different pathways in our nervous system are activated. For example, with the experience of previous pregnancy loss, and you feel a pain in your tummy whilst pregnant, your body will activate processes that remind you of your previous experience. Because the brain stores information in a use-dependent fashion, the information stored depends on experience throughout life. For example, if past pain came with a life threat, future pain is interpreted as a signal of great danger. Normal development of the nervous systems rely on specific experiences at specific times during development. For example, caretaking behaviour is learnt during an individual's own experience of being parented. These critical periods are windows of vulnerability during which the organising systems are most sensitive to environmental input, including traumatic experience. If the life-threatening experience happens in early childhood, it is coded in implicit or non-conscious memory, which is felt in the body. This is not a memory that can be recalled as an event, but recalled as a sensation. I believe it's important to think about trauma experiences for partners as well, not just a pregnant person, but thinking about how the pregnancy journey is impacting on the partner's mental well-being in relation to their life experiences. So untreated mental health conditions during pregnancy can lead to unhealthy lifestyle behaviours, such as under or overeating, sleep disturbances or substance use. These can increase complications during pregnancy. There is a risk of preterm birth or low birth weight, both of which may adversely affect your baby's health and the bonding and feeding experience. Prolonged high fetal cortisol, stress hormone, exposure has a long-lasting imprint in the baby's stress response system. Hence, as an infant or child, they may be more sensitive to stress and find it more difficult to self-regulate. So the following slides describe different modalities of treatment and management for prenatal anxiety and depression. There are many different modalities for treatment now too. Later will be some slides that has some logos that highlight a few of these. Having different ways of self-directed recovery opens up options to find a way that works for you. You may gain inspiration from podcasts, apps, online networks, and some organisations have self-help programs, which are usually for mild to moderate conditions. Social support. It's important to ask for help or say yes when someone offers. Putting together a list of people to contact when in need of a talk. Peer support, existing friends and family, new friends, such as meeting new parents to be at an antenatal program, or joining a trusted online platform such as Gidget Foundation Australia's Facebook page, Gidget Virtual Village. Therapeutic support can be through seeing a psychologist or mental health practitioner. You can receive cognitive behavioural therapy, interpersonal psychological therapy, dialectical behavioural therapy, directive counselling, and there are other forms of therapy that may be more suitable to you. Self-care. There are things that you can do to promote a sense of positive well-being. Activities that enhance pleasure can make a big impact on how you feel. Engage in physical activity. Try some yoga. Enjoy a healthy, balanced diet. Social connectedness, even if it is on Zoom. Mindfulness or meditation. There are some great apps such as the Headspace app. Educate yourself with what to expect. Avoid forming unhelpful habits. Have a think about what is self-care for you. What puts a smile on your face? What activities lift your mood? And medications. Medication use during pregnancy is often a very difficult decision to make. This decision should be done with a risk and benefit assessment in conjunction with your medical provider. So many medications to help treat and manage mental illness are considered safe to use during pregnancy. Some health professionals can be reluctant to prescribe medication if you are pregnant or breastfeeding. MotherSafe is a great service available for the general public and health professionals to consult on best practice in this space. Take this number, take a photo of the slide, take this number with you to the GP and make the call together. Take a photo. There we go. This slide shows a matrix that looks at considerations to risks and benefits of medication to use during pregnancy. Essentially, untreated mental illness can have a negative impact on fetal neurological development and long-term implications to the child's well-being. The risk is considered in relation to what we know about possible adverse outcomes from exposure to medications used to treat various mental health conditions. There are lots of professional supports as well. Talk to your GP about what is happening for you. Through your GP, you can access a mental health care plan in which Medicare will pay a portion of your psychologist's fees. A psychologist or clinical psychologist can be accessed privately, or your GP may be able to guide you in the right direction, or a search on the Australian Psychologist Society website can help identify a psychologist suitable for you. And this website is in one of the later slides. If you or your GP or psychologist feels that an assessment with a mental health medical specialist is required, the GP can refer you to a psychiatrist. Speak to your midwife or obstetrician or hospital social worker about your challenges. There is the option of a community child and family health counsellor, and if you have your after you have your baby, the child and family health nurse will offer parenting and infant development support. There are also several non-government organisations in the community that offer different levels of support. So some barriers to accessing support. Recognising and being honest with yourself that you are struggling with your mental health can be hard. Reasons for this can vary from individual to individual. One of the biggest worries about speaking up is stigma. That is, worrying that you will be viewed in a negative way because of your mental health. There may be a fear about becoming vulnerable, so being in a position of becoming more hurt. Identifying yourself as being mentally unwell may affect how you perceive yourself and perpetuate self-depreciating talk. The people around you may be dismissive, invalidating, and actually try and hide your unwell mental state. The cost of accessing some services may be too much. Free services are available, but there can be time-challenging reasons, timely access can be challenging, and there are usually waiting lists as well. A previous invalidating or unhelpful experience with a psychologist may prevent you from trying again. Finding the right psychologist is like finding the right pair of shoes. Sometimes you need to try a few to get a comfortable fit. You may worry about discrimination against you, especially in relation to your workplace. Misconceptions about medications may limit your treatment options. And fear of child protection services. Many parents fear speaking up about their mental health challenges because of the fear that they'll be seen as unfit parents and risk having their children removed. I can assure you that if the Department of Communities and Justice, DCJ, is notified about risks to child safety, the situation needs to be very unstable for them to become involved. And even then, DCJ aim to support families and to keep families together. So noticing barriers to speaking up and seeking support, and be curious. Ask yourself, is this a real barrier or a myth? Will I find a way forward if I challenge the barrier? If you are struggling, seek out a person in your life that you know will validate how you're feeling, or start with your GP, midwife, or obstetrician. If you are worried about a loved one, ask them if they're okay. Let someone know you are there for them, and if and when they are ready. We don't have to fix other people's struggles. Just be there and listen. To listen and validate is a really powerful means of support. There are many different types of illnesses in life. Mental illness is one of these. It may be acute, it may be chronic, and there are treatments, and there is management, and there is recovery. COVID-19. So COVID-19 is easily passed from one person to another. In most healthy people, the symptoms of COVID-19 are mild. Severe symptoms are more common in older people and those with chronic illnesses. But this virus is still new, and the evidence that supports clinical decisions is still evolving. At this stage, the evidence indicates that having the COVID-19 virus during pregnancy increases the risk of developing more severe illness symptoms and increases the risk of a premature delivery. If your baby is born too early, there is a much greater chance that your baby will require an admission to the newborn special care unit. Transmission of the virus from mother to baby during pregnancy is possible and is termed vertical transmission. The Australian Technical Advisory Group on Immunisation and the Royal Australian and New Zealand College of Obstetricians and Gynecologists recommend that pregnant women can get the Pfizer or Moderna vaccine at any stage during their pregnancy or if they are breastfeeding. Your attending health professional will guide you with assessing the risk of harm to your baby from COVID versus the risk of harm from the vaccine for your individual circumstances. At this stage, there's no evidence that the COVID-19 vaccine affects fertility. The decision to breastfeed or not remains your choice. There are no reports that the live virus is transmitted to your baby through the breast milk. If you have had COVID-19 or are COVID-19 positive at the time of giving birth, your choices around breastfeeding or formula feeding will be supported. Breast milk helps protect your baby against infection as the mother's viral antibodies are present in her breast milk. The option to provide breast milk is best for most babies. So I encourage you to take a moment to take a photo of this slide. It's a resource slide where further information about COVID-19 in the perinatal period can be found. So COVID-19 is having a large impact on the pregnancy and birth experience. Pregnancy and preparing to bring baby home are exciting times to share with others and do a bit of shopping. Lockdown and isolation have really changed what this looks like. We must acknowledge that for many people, their pregnancy and birth experience will not meet their dreamt expectations. The mental adjustment to having an online baby shower, gender reveal, or purchasing major baby items without viewing in the shop might be very challenging. With the risk of contracting COVID-19 anywhere we go, the hospital antenatal ward is no exception. It is understandable to experience heightened anxiety about attending a clinic setting for your antenatal appointments. However, we can't stress enough about how important it is to attend. The degree to which the system can allow support people there for support may be limited due to COVID restrictions. Current hospital restrictions include no additional visitors to your antenatal appointments, and visitor exemption applications are required for a partner to attend the hospital for the birth and postnatal support. If your baby is in the special care nursery, only one parent can visit at a time. These are really hard conditions that are necessary to try and keep your baby, to keep you safe and your baby from COVID-19. We acknowledge this is hard for all family members that are unable to be present for support, connection, and meeting their new grandchild or sibling or family member in the early days. Returning to a hospital for pregnancy care after previous birth trauma can elicit strong reactions in the body. Your plans to create a less traumatic birth experience may be impacted by COVID-19 restrictions. Please speak to your midwife or obstetrician if you would like some extra support around this. There are numerous cultural practices that are being impacted by COVID-19 restrictions. And service constraints due to COVID-19 means your care might look somewhat different. For example, some appointments are being done by telehealth. Health staff recognise challenges imposed by COVID-19 restrictions and are doing the best they can to maintain optimal quality care during these challenging times. We also acknowledge the extra worry of the pressure to get vaccinated. So the impact of COVID-19 on pregnancy and birth experience. It's your reaction to adversity, not the adversity itself, that determines how your life story will develop. How can we be creative to bring back some missing pieces of our journey? We can use social media to involve family or friends around the world. Virtually taking your partner with you to your antenatal visits, FaceTime during the appointment. Involve siblings in making cards and creative gifts for the unborn baby. Embrace preparation as a family, all decorating the nursery and choosing outfits, thinking of names, and wondering about the new addition's personality. Frame ultrasound photographs and share with family and friends. Plan a post-birth celebration out of lockdown. Who said your baby can't attend their own belated baby shower? However, celebrate online for now. Connect with other parents-to-be via social networking media and talk about your experiences. Also, babies love music. Turn it on and dance with your pregnant belly. Or take your baby for a leisurely stroll. We gain resilience, resourcing, tenacity, and growth post-hardship. Growth through adversity is a well-documented concept. Resilience is based on your ability to surround yourself with the right resources and adapt to the challenging landscape. Keep your eyes on the end prize and keep perspective. It'll be worth it. Mothers raise generations, and you are doing just that. If you have the power, embrace it in every way you know how. The following few slides contain various types of resources. Whilst I put this up and leave them for a short bit each for you to take photos, Chris is going to talk about Gidget Foundation Australia.
Thanks, Katrina. Gosh, what an impact seminar. Thank you so much for that. So at Gidget Foundation Australia, we do lots of different programs to help new and expectant mums and dads. And it's also not just new and expectant. We also help offer counselling, free counselling services, up to 20 sessions or bulk billed for women who have gone through miscarriage or a stillbirth or some sort of other neonatal loss as well. And we offer services to men and women. So we have a couple of counselling programs. We have the face-to-face, which we call the Gidget House program, which obviously is not face-to-face right now. Everything's being conducted via telehealth. But we also have our Start Talking program, and we can reach people Australia-wide in this Start Talking program, and that is also counselling services up to 20 bulk billed sessions, all conducted via telehealth or FaceTime or even via telephone. We can be quite flexible. So these services are offered, and all you need to do is get a GP referral and a mental health care plan from your GP as well. And all of these can be found online at our gidgetfoundation.org.au website. We have lots of resources online. We have a COVID hub with lots of tip sheets to help you understand anxiety or depression or loneliness or grief and loss, or we have some tip sheets for dads as well. So feel free to have a look at that website. There's lots of useful information there. So as well as our counselling programs, we have an emotional wellbeing screening program that we conduct in quite a few hospitals in Sydney and Melbourne and Queensland as well. We also have a Gidget Village, which is a treatment group program that we run for 8 weeks, and it's a pretty intense group program, and it's a really lovely supportive atmosphere, quite an educational focus, but really lovely to be with other mums during that time after you've had a baby as well. And we have Gidget Virtual Village, which Katrina mentioned. And on our Facebook page, we have one for men and one for women, and you can go online, and it's a moderated group, and lots of beautiful support is available there. You can just write about how you had a terrible night, you know, up all night thinking about something or whatever your concerns are, or to share joyful things as well, and you'll get lots of lovely supportive comments in the chat around that too. We also have bunny books which are available to buy, and these books are really gorgeous little stories about a bunny, and they all have different psychological strategies in them to manage anxiety and depression sort of symptoms, really, and they're really excellent. And we've also just launched a training and development institute as well, where we are training fairly newer sort of psychologists and social workers to be able to do the counselling as well, because we have big wait lists and we're wanting to really address that and get our clients timely support as much as we can. So the main thing really is, if you need some support, is to reach out, probably start at your GP and see if you need extra psychological support. You can go to the Gidget Foundation website and have a look there and see in more detail what we offer, because there's been a lot of information today, and obviously these resources that Katrina's put on these slides are also really helpful as well. Thank you.
It's always fun trying to find my bearings when I come back on. So because I've been talking and presenting, I am not very familiar with what's in the chat, but our panel is. So I might just move over to the panel. And
I thought there was one interesting question, Katrina, from Joey about just from a psychological perspective. I don't know if Lara also wants to chat about this one with me, just about getting worried about getting touched on her torso and that sort of phobia, and what to do about that with checkups and birth, obviously, where everything is sort of out there and exposed. And I think, you know, there are lots of women who have worries and anxieties about the medical process and the sort of all the things that go on during pregnancy and getting all the checkups. So I don't know, Lara, do you have any ideas? I've got some too.
Yeah, so I'll, I mean, Chris, I'm sure that you have some really, really great ideas, but I was just pondering over this question. You know what? You're not alone if you don't like being touched on your torso. It's really quite a common thing. And look, for some people, it may be to do with a negative experience at some point. You may not remember it, or it may not. A lot of times what I've asked women to do, or to try to do, is to actually think about what that touch means for them, and to also be mentally prepared, and to let the practitioner know. I mean, I'd be quite concerned if practitioners really thought that was silly. Practitioners know that this is your body, it's sovereign. And so you have every right to say, look, I'm not feeling very comfortable with this. And really the practitioner who's doing whatever needs to ask for your permission. And you give that permission knowing what they're doing, and them talking you through the process usually makes things a bit easier. But if not, some of the apps that are available for meditation and mindfulness can also be utilized in these particular situations. So I've asked a lot of clients I see, and actually myself as well, I don't like ultrasound. So I would concentrate on the baby and be very mindful of the heartbeat and the little person that I'm seeing, and that made a whole load of difference. There could be times when people are pressing really quite firmly or quite lightly on the abdomen, and these will elicit different responses from you. For some people, the firm press is a lot more comfortable than the light press, for example, and you can let the sonographer know that, look, I don't like the light press, get that part done quickly and let me know when it's happening and what it is you're looking for, because that will take your mind off the tactile sensation and divert your mind more to what you're looking at over on your screen. I get the point as well that not having your husband there is really, really tough. And in part of Katrina's presentation, she spoke about creative ways of having hubby attend your antenatal or ultrasound visits. I know it doesn't cut it, but it is an option. So having the voice of your partner there, or another family member who might usually accompany you, or a really good friend in the background talking to you through it, can also be quite soothing, because you've got that familiarity there and you're not just kind of sitting there with a stranger poking around on your tummy. So I think big things, takeaway message is, permission, being asked and giving permission, making sure that you're heard. This is not comfortable, tread lightly. Also asking for the sonographer to be quite explicit with what they're doing and what they're looking for, and planning ahead. So when you're mentally prepared for the process, it makes it that much easier. And if you're finding that you catastrophize about the experience during the planning, please take a moment to ground yourself and just get in touch with why you're about to have this ultrasound, which is really, really uncomfortable, and that can take the edge off it too.
Yeah, I think they're great points, Lara. There's sort of ways to ground yourself. Might be looking at, 5 things in the room that you can see, or things you can hear, or just doing some breathing, or like Lara's saying, like maybe you can focus on, if you can FaceTime your partner or a friend and get them to sort of be with you and talk to them. So it's a fine line between sort of balancing what's happening and being a bit mindful of what's happening, and also some sort of distraction to keep you, I guess, in the moment and able to manage and go through the checkups and whatever you need to do. But I think being an advocate for yourself can be hard sometimes. So I think it's really important, if you can't do it, get someone to help you do that, and get maybe that person on the phone or whoever is there to help explain to the sonographer or the doctor or midwife or whoever you're seeing. And then maybe, if things don't settle, get some other sort of counselling support around that, and try to find out what it's about. And maybe even, I was thinking, if it's other people's touch, then maybe you can start with putting some nice body lotion on little bits of yourself and see how that feels. Maybe start with your shoulders, or somewhere that feels okay, or your arms, and then you can maybe work towards your torso if it's you and it's safe, with a nice oil or body cream, or something like that, if you can manage that as well.
I find also that because touch is a single sense, and if you're focusing on that only, it can be really overwhelming. Something that Chris has said in her advice as well is, the 5 things you can see, 5 things you can smell, etc. So even, if you've got a nice, I don't know, perfume that you like having around, and focusing on that smell rather than focusing on the touch. Again, the sound of someone there that is a trusted person, is familiar to you, like your partner. You can focus on that sense of hearing as opposed to the sense of touch. Looking at your baby, listening to the sounds that are there, whether it's the heartbeat or wherever, that will take the focus off that single sense of touch, and it won't be as magnified. I hope that these are somewhat helpful, and I'll try and find out if there's a way to get some grounding techniques mailed out.
That's right, Joey's saying thank you. That's lovely. The other one I thought Anna Maria might want to answer was about the home birth, and someone mentioned the Birth Time documentary, which is a wonderful documentary about empowering women and trusting in yourselves and bodies during birth and all of that. I don't know if, is Anna Maria still there talking about?
Yes, I'm still here.
Yeah, home births or...
home birth is, at the moment, is the documentary that is being available. At some session is being focused at the moment to, obviously, a health professional. Hasn't been advertised that widely, and is like going to the movies and you pay for it, you get your ticket and you go. I may need to find where they are currently, and because of the COVID, probably they're not having any showing at this stage in Sydney. And they have done a few, and it's a really nice documentary to see, because it shows, you know, real couples experience through the birth, that they birth experience, and how they feel, and they express they, you know, their emotions and their worries. So they share with the rest of us how they feel. And the idea is for the clinician, for the health professional, to see how, you know, how we can improve the way we provide services or we care for these families, how we improve in the sense that, you know, we have a better outcomes. Not always it's going to be, you know, someone who has, it's a lot of families that have good outcomes and experiences on their birth pathway. However, there are some, you know, negative experiences within the system, and we need to learn from those, you know, experiences to improve what we do. So definitely it's a good documentary. If someone can get on and have a look, probably it's easy to Google and see where they're going to be the next showing. And if you have an opportunity to watch it, I would highly recommend it. In terms of home birth, that's another, you know, that's a very sort of personal choice, because it's an option that we have in Australia for home birth. Is provided by private midwife. And every midwife, like I can't give you more sort of information in terms of, you know, how the private midwife run their own business, but obviously they have their own criteria and focus on what they provide. So it was a comment in terms of antenatal care at home. Yes, there are some model of care from the midwifery point of view. What is they can call, they have different names, they can call it MGP or midwifery good practice, caseload, where some of them, not always, they offer the home, the antenatal care at home. In the area that I work at the moment, we are still offering those antenatal care, but unfortunately it's very limited, the amount of women they can take into this model of care, but it's something that is available. And and we're still providing that, like I said, antenatal care in the women's home, which is, it's something quite positive for them, because the whole family comes together, you know, in the living room, the kids, and they have a chat with the midwife. Sometimes they sit and they have a coffee. It's a great model. It's like the gold standard, what we call in the midwifery care. And most of the hospital, they have some sort of, you know, model of care similar to that, and they provide very similar sort of service. There are alternatives to that as well. They probably less intense sort of, you know, involvement from the midwifery point of view. Since I'm talking about the midwife going to the home, we're still providing that care in the clinics. And there are different options. It's just different, you know, different facility, different hospital, they have different options. It's just made of for you, for the woman, just to see what they can offer where, you know, where you book to have the baby.
Great, thanks, Anna Maria. Just before we finish up, there was just a note in the chat about beers and bubs, and someone we got shared a. Where did that go? That sounds like a great program for partners. I've learned. I didn't know about that.
So Chris has kindly shared the web address for Beers and Bubs, and yes, that's geared towards dads and providing information on childbirth and all the things that dads need to know. I think dads sometimes feel a bit left out. But I think in future sessions that we'll be conducting, dads are addressed, particularly in the postnatal period. So stay tuned.
Yeah, nice. And just a comment to finish up, there are new models of care which provides continuity of care throughout the antenatal and postnatal period. So That's awesome. There is options there. So I think we might conclude, and I'm just going to say thank you to everyone for attending. And I hope that there's something that you can walk away from today's webinar. Next week, we'll be hosting one on postnatal, the postnatal period and mental wellbeing. So yeah, get prepared. If you haven't had your baby, come along to the next one to be prepared. All right, so thank you all, and thank you to our wonderful panel. Really appreciate your time.
Thanks, everyone. See you next week.
Thank you, everybody.
Bye.
Bye.